I feel like I feel like a broken record, but CMS is still not saying anything negative. They're just still trying to get their ducks in a row, for lack of better words, because they have many other states that are trying to get on board with what we're doing.
Have they given any indication to their time frame?
No, well, they were at one point, Steve. They were saying administration timeframes and policymaker timeframes when they had some changes. Then a couple of months later, they told me sometime around May, because that was when actual administration was just going to come on board. And of course, that's gotten later and later. But we have heard from other affiliates that are connected or in meetings with them that Kentucky comes up all the time about our amendment and what we're trying to push here in Kentucky. So we hear from other folks that the amendment's still very favorable in the CMS world. Just a few other things. The CCBHC Certified Community Behavioral Health Clinic, we have a hard start date to start that in January. And that'll be with 4 of our existing CMHCs. And that will be for 8 quarters starting January 1 of 2022. And so I just wanted to update you on the start date, really.
That's been a big, heavy lift for a lot of people in the state.
Yes, that's been hard for us, and getting things up and running as well because of using a 2016 application. It's been hard in the fact that I'm not sure that CMS was prepared to move out with Kentucky and Michigan when they did in 2020. So, sorry. That's the CCBHC. We also have a couple other things I just wanted to give you all a heads up on. There is a SED SMI waiver draft group that we've been working with for quite some time. We started our technical assistance for the draft in October the 20th. And we are, sorry, I'm looking in the chat acronyms. Yes, thank you, Dr. Terrio.
I was going to get there myself.
I'm sorry. We've been working.
Hey, Leslie.
Yes.
So our friends at Behavioral Health have tried to explain to me a little bit of what that designation means. Could you just talk about that briefly? What designation means for those 4 CMH communal health centers?
Yes.
CCBHC,
So the CCBHCs are going to provide a really intense integrated care, which they can do physical health, behavioral health, and substance use disorder.
CCBHC stands for a Certified Community Behavioral Health Clinic.
Yes. So when CMS reached out to us, they said, go forth and be merry and use a 2016 application that we had not approved back in 2016. So that we had to go kind of backtrack. We've worked really hard with the Department of Behavioral Health to work on this project, but it's been hard. CMS went probably 6 to 9 months without giving us very little guidance on how to set things up or how they wanted it to look, because I think they were pushed to push out to 2 more states, and they weren't prepared to go back and pick up.
Yeah.
So
what happened historically is in 2015, there was a planning grant. Kentucky participated in that, 14, 15, 16. Then 8 states were selected to move forward into a demonstration and implement CCBHCs in those states. And Kentucky was not one of those 8. And then in the initial spring of 20, right, Leslie? COVID legislation, COVID relief, actually the demonstration got expanded to 2 states. So they were added states 9 and 10, and that was Kentucky and Michigan were those 2 states that were added at that point. So we've joined 8 other states as a demonstration state. And really there's been some SAMHSA work around this in smaller pieces, but the 4 centers, which is 7 counties in Louisville, New Vista, Northern Kentucky, Pathways, which is Ashland, Moorhead area, and North Key, Northern Kentucky, New Vista, and Lexington. They kind of put this whole process, as the DBH and Leslie and her team at Medicaid, aside because they didn't get funded in 16. And then suddenly we heard it's going to happen in the spring. But I think Leslie and her team and DBH, and I heard it from our national partners, that Kentucky was one of the states, and then we heard about a month later that was the case. So it's been hurry up and get started, right, Leslie?
Yes, Yes, and
So
of course,
that results in a higher reimbursement rate, is that right, for that?
The payment methodology is a prospective payment, and the CMHCs will get, those 4 centers, or CCBHCs will get a daily rate, right, Leslie, based on a contact that day.
Okay.
yes.
And the key is prospective, so you can build in costs, so you can maybe increase salary to become more competitive. They got to do some integrated care, so bring on those people on board, things like that. So it's a good opportunity. Unless there's an enhanced match rate as well, is that true?
Yes, there is. There's an enhanced match rate for the 8 quarters, and then an indirect extra 1% during COVID. Whenever they shut that off, we have another 1%. And our start date actually starts the 8 quarters, so we've not missed any time, which has been really good.
The reason I ask is we're fixing to award each of those community mental health centers through our process here at Justice, working with behavioral health, and just wondering how that may or may not impact what grants we're prepared to give them.
Oh,
There'll
and
still
Diane, if you
be
want,
CMHCs as well.
Yes.
And there'll be a CCBHC. They maintain the CMHC status, one for IDD services included in this, as well as residential. So I think some of those things that got grant funded are still a need. Especially as we learn more about CCBHC. All we've done so far is plan. We haven't done CCBHC yet.
yeah.
Well, thank you. I didn't mean to take up so much time with that.
No,
It's
good
not a
question.
problem. And Van, if you need to meet with me separately some other time, feel free. I always enjoy meeting with you. So we're working on a draft waiver right now, and I'll be totally honest, don't have the money, but we're trying to get this drafted and get it out there. It is a severe mental illness, severe emotionally disturbed draft waiver for Kentucky, which would be for adults as well as children. We're just in the beginning stages. I started some free technical assistance in October. We've got a couple more of those sessions to go. But I did want to let you know that Kentucky's been talking about, and Steve Shannon and Dr. Schuster, we've all been talking about having an SMI-SED waiver for probably 20 years. So this would be very positive for Kentucky. Some other things that we've got going on, just to let you know about, is a mobile crisis planning grant. We applied for that along with our partners in DBH, and we received the grant, which is very exciting. We asked for $800,000, and I think we got $796. So we're really excited about that, and it's to bring together all the wonderful. We've got lots of wonderful programs out there that are addressing crisis in general and mobile crisis types of services, but they don't connect well. We're kind of in our silos, and we want to plan this year for one all-inclusive model for Kentucky. So that's something we're very excited in. I will tell you that the deliverables are extremely hard. A lot of you all will probably be called to participate in stakeholder meetings. And Leanne Fitzpatrick, who's going to speak after me, is also involved in that mobile crisis planning grant. So if you have any questions, you can reach out to her as well. But that's something that's very positive. Another thing that I just want to mention is we've got 3 or 4 housing collaborative kind of things going on right now. We know housing's needed. We know employment's needed, and it's not just SUD or behavioral health, homelessness. There's all kinds of populations across Kentucky that are needing housing assistance. So we just completed a collaboration with the federal government related to housing, and it was specific to SUD. But once we got our Kentucky team together, we realized that it was really a need across the board, and that's kind of led into other initiatives. And if you've heard about it, we've just recently started a Kentucky Housing and Health Collaborative, in which we're working with the Housing Authority on some ARPA funds that they've received to see if they can meet some needs, and maybe we can surround with some other supports that Medicaid can cover, because we can't cover room and board. So we're kind of trying to work together. Let's see. I think those are the main things, Steve, that I wanted to bring up today. If you have any questions, you can reach out to me, of course. And I've asked Leanne, if you're on the call, could you just give a few updates about reentry in general?
Leslie, before that starts,
Yes.
did you see in the chat that,
Oh,
Dr.
no, sorry. I'm getting it.
well, it's just that they'd like to meet with you out of the meeting, so.
Sure.
Hey, Leslie, it's Shannon, Dr. Smith Stevens. Yeah, that's
Okay.
just for another time, but just so that I won't forget.
And Dr. Smith Stevens, I can connect you to the 4 CEOs who will probably be able to answer your question as well.
Fabulous. Thank you.
We can do that.
And Steve, will you, if we still need to have a meeting, just let me know that I need to schedule something for us all to meet as well, okay?
Yep.
I appreciate that. Hey, Leanne.
Hey, good morning, everyone. Yes, we continue to meet monthly on our reentry program that I think I talked about last time that it began in 2018, that we are focusing on 2 facilities, KSR and KCIW. And we're looking at potential releases within 6 months. And we also follow a daily discharge report that comes out, and we refer to our MCOs. And we do some care coordination to make sure that they are getting what they need post-release. Those meetings continue. We have I finished yesterday an updated reentry coordinator list that's sent out to all of our partners within that team. We work with KIPTA as well and they have connectors that assist inmates with completing a Medicaid application. DCBS reported last month that they are through 2020. There was an action that every inmate had a Medicaid application completed, and they have done and worked through those applications, and they're started with applications. So every new inmate has an application that is completed, regardless of need or whatever. And they're up to January working on those. We started a process that if someone is released and it's questionable about their coverage or benefits, are the reentry coordinators, the probation officers, DOC staff, Kristen Porter and her staff are wonderful to work with, and communication between DCBS, they get priority. So any kind of application, any kind of question that comes from someone that has released or within the DOC system, it takes priority over any other applications within DCBS. You might have any questions?
At our previous meeting, we had talked about, is there a need to expand this to other facilities, perhaps in anticipation of the 1115. And we realized there's money attached to that expansion. And that was, I think, the discussion that we had back in September, or it came up and we decided not to take action. Is there any thought, Leanne or Leslie, of expanding it to other facilities in anticipation of the 1115, or is that just not?
So, Steve, a few of us got together the other day and had a discussion related to that. Of course, I always tell you I can't promise anything when we don't have funds to do it. We would need funds to expand and or sustain, since there is no funds there right now. And Lee Geis is on as well, and I thought if you had any additional questions that she might be able to answer.
Good morning.
Hey, Lee, how are you?
Just fine, thank you. The issue with expanding the program really is having to do with resources to sustain the structure of it. When we first started, this was the pilot project, and we assumed, and yes, I understand that I use that word intentionally. We assumed it would be a few months, a year. It's been several years now. And so that the resources we applied to kind of build the infrastructure for this program have been completely dedicated to this program, way more than half their time. And that's just for these 2 facilities. And so when we, if we ever are able to, and we certainly hope we're able to expand the program, we will have to have And by resources, I don't mean just money, but funds to have actual folks, more folks involved with the program. So, you know, it's a partnership with corrections and the MCOs, and it's been a great partnership. I think the program is worthy of expansion as soon as we're able to move forward. Of course, there are a lot of moving parts right now on incarcerated people. In fact, there's a bill, a piece of federal legislation called Build Back Better. And it's a huge piece of legislation. And a very small part of that is to allow Medicaid coverage for incarcerated individuals 30 days before they're released. So this would change, of course, the structure of the reentry program if that bill were to be passed. So keep your ears and eyes open for that as well, because that would be a huge impact on this population and on Medicaid. And we're watching and listening.
Lee, is am I correct in thinking if we get the 1115 approved that we've been waiting on for 2 years now, that will allow some resources to expand that program?
That would be my understanding. Yes.
Is that correct, Leslie? I think that's true.
Sorry, I was muted. Leanne, we did put reentry into the 1115 amendment, correct?
Yes, yes, we did within 30 days of release that the MCO would come in and assist with care coordination and follow-up appointments after release. Yes.
It's been so long, Leanne, I forgot what's in it.
Yeah, I knew we mentioned it, but I couldn't remember how far we went with it, Van. Of course, Van
there-
was involved with the amendment.
And yeah, he was involved in the very beginning as well with NGA. Also, there have been several states that have submitted 1115s, which in 1115 gives the Medicaid authority the right to do things, break the rules, basically, because there is a federal exemption that if you're incarcerated, your Medicaid benefits, you're not allowed to have them. And Kentucky does suspend those benefits. So there have been several states that have submitted a 1115 for that 30-day prior to release, having coverage turned on so that the MCOs can step in with them.
And Leslie or Leanne, there's a question in the chat, and I think somebody's misunderstanding that the 1115 was approved.
No, it's not approved. It went through public comment here in Kentucky and then went through a federal public comment period that ended on January the 9th. We got a few generic questions, they said, that were not related to specific types of providers. And we've addressed those questions since that time, but that's the last information we've received is right after January 9th. We do meet with them on a monthly basis and I keep it on the agenda.
Right. And this 1115 is, you know, there's other things that I get confused with 1115. This is unique to this process, right? Incarceration piece.
Yes, specific to incarceration.
So we're all waiting, maybe impatiently, for our friends at CMS. So, all right. Any other questions for DMS? And there'll be a standing item agenda each meeting, an update from DMS, which is typical of tax, right, Leslie?
Sure, and I don't mind a bit, Steve.
Good. All right. Adrian, Housing and Homeless Coalition of Kentucky. And you should be able to share. Oh my gosh.
Yes, hang on a second.
Adrian, I stopped sharing, so you should be able to.
Okay. Good deal. And can people see my screen?
Yes, we can.
Okay, cool. Yeah, 2 monitors. sorry. You would think after almost 2 years, we would like be able to do this, no problem. I just want to start this slideshow. Okay.
Try down at the, on your bottom of your screen, Adrian, where that
yeah.
scale is, the little slideshow thing. The last icon before the scale.
Thanks, Charlie.
There
I
you
learned
go.
something new today. I learned something new every day. Okay, cool. All right, thanks for your patience, y'all. All right, so Steve had asked me to talk a little bit about how housing intersects with people who are re-entering society from incarceration. And so this is something that we are very interested in. We know that there are a significant number of barriers to getting folks housed after they come out of jail or state-operated corrections facilities. So here's a little bit about the Homeless and Housing Coalition of Kentucky and the Kentucky Interagency Council on Homelessness. I actually am wearing 2 hats today. HHCK is a statewide advocacy group. We're working on eliminating the threat of homelessness and fulfilling the promise of an affordable home for all Kentuckians. We operate statewide AmeriCorps and VISTA programs to help communities address housing insecurity and homelessness. We advocate for nonpartisan housing policies on behalf of low-income Kentuckians, and then also we provide permanent supportive housing to chronically homeless households. And so we have kind of a unique perspective on housing and homeless issues in the Commonwealth. So the Kentucky Interagency Council on Homelessness is more of a policy planning body. It was established in statute in 2016. Prior to that, it existed per executive orders, going back to Governor Ernie Fletcher. And so part of our job is to educate policymakers on what good homeless policy looks like, and just be a resource and kind of the connective tissue between state agencies whose policy work does affect people experiencing homelessness. Next slide, Adrian. Okay, so here's the issue. From the National Low-Income Housing Coalition, and we are the state partner group for this group in DC. They do a lot of research. They're very helpful. We know that the United States incarcerates our citizens at a pretty high rate. Nearly 1 in 3 Americans has a criminal record. And so it's really important when we look at housing policies that we're kind of centering how people coming out of these facilities can get into stable housing, because we know without it, we're going to deal with subsequent recidivism. There is a connection to homelessness, and honestly, it's just the right thing to do. Okay, so I want to talk a little bit about HUD's one strike rule, because it's had just a huge impact on housing assistance and the way we view the larger housing market in this country. So just as a refresher, HUD equals the U.S. Department of Housing and Urban Development. And in the 1990s, the Clinton administration created a one strike and you're out policy for public housing. And the idea was, you know, all of these public housing complexes that loom large in people's mind, think of like Cabrini Green in Chicago back in the day, were just hotbeds of illegal drug activity. And so the Clinton administration was going to clean this up, allowed housing authorities to evict for drug use and preemptively screen out and deny housing based on all kinds of drug use and felony convictions. So if you go on the internet, which is a scary place sometimes, there is a report from 1997 that was done by HUD itself. And at that time, Kentucky had 70% or 103 of its public housing authorities adopting one strike policies. Now, a lot of people don't realize housing assistance in this country is incredibly fragmented among the federal government and even among states. You do have, I mean, the fact that Kentucky, it's kind of like our counties, like we have 120 counties and we love each and every one of them. But that's a lot of housing authorities with a lot of different rules. Okay, so we're going to talk a little bit about the current housing choice voucher policy. And just as a refresher for people who don't live in this world every day like I do, HUD funds two types of public housing authorities. One type will do project-based or what we traditional public housing, what I call hard units. And the other will do vouchers to bridge the gap between renters' incomes and the contract rent on the private market. And this is actually kind of an oversimplification. Some housing authorities actually do both. So I live in Frankfort and Franklin County. We have the Housing Authority of Frankfort. They have complexes that they own and operate, but then they also operate their own housing choice voucher program. For many of our housing authorities across the state in more rural areas, those housing authorities don't have the capacity to operate a housing choice voucher program. And so those vouchers get kind of defaulted back to Kentucky Housing Corporation. Kentucky Housing Corporation serves as the PHA for 87 counties out of the 120. So housing choice vouchers also used to be known as Section 8, and some people still call them that. So if you hear us use those terms interchangeably, that is why. So from the current HUD guidebook telling PHAs how they're going to operate these housing choice voucher programs, they talk very quickly about background screening and say that the PHA must conduct background screenings to ensure that, no member of the household is subject to a lifetime sex offender registration. Another big, just non-negotiable is you cannot have manufactured methamphetamine in a federally assisted property at any time ever. That is a no-no. But then the other thing is that it says explicitly PHAs may establish additional non-discriminatory criteria for admission. And here's where it gets tricky, and I'll get into this in later slides. So then later it talks about denial of assistance for criminal activity. They can deny based on criminal convictions, or if the preponderance of evidence indicates that a family member has engaged in such activity. So that's not a real high standard, not a lawyer here, but not a real high standard for proof, if you will. If they decide to deny based on a criminal conviction record, they have to tell the applicant, and they have to give the applicant an opportunity to kind of appeal it.
Okay, Adrian, the Public Health Authority can make that determination on preponderance of evidence?
Mm-hmm.
Okay. Wow. Didn't realize that.
Yeah, so I mean, you've got two competing policy priorities here, right? We want people to live in safe communities where they can thrive.
Mm-hmm.
I think we can all agree that what we don't want is, anybody on this call ever watch The Wire? We don't want projects, where people, like, the only way to earn a living is to turn to the drug trade. We get that. And we also want to make sure that children are safe and that sort of thing. But in the meantime, if so many people in Kentucky have a criminal record because we have tried to incarcerate our way out of many social problems, then this really shuts out a lot of people from accessing just what is basic mainstream housing assistance. So the last bullet point talks about, PHAs may establish policies that are stricter than the regulatory requirements above. But they just want to make it really clear, PHAs can make it harder than it needs to be. Their caveat is that these policies do not discriminate in violation of civil rights. So we'll get to that. Okay, so in 2016, the federal government said, hey, we have a problem with the war on drugs. We have disproportionately incarcerated Black and Brown Americans. And therefore, if we have these one-strike policies and these policies to screen people out, that is going to have a disproportionate racial impact. Also, with the case of folks with substance use disorder who may have been incarcerated or severe mental illness, that's also, people who may have disabilities may be shut out of this process as well. And this is a problem. So the Department of Justice and HUD issued a joint guidance. You will see that it is not a rule, unfortunately. And it basically strongly suggested to PHAs to stop doing that, and that they should look at things on a case-by-case basis instead of these standard blanket policies. Some PHAs took that seriously, others didn't. So, and there's really no stick from the federal government to make them do so, unfortunately. So, and again, we have this competing priority, right? Or this competing policy dynamic, because PHAs are supposed to provide housing that need it most. But they're also kind of judged on their ability to lower levels of crime in their housing. And then also, if you deal with the private market and housing choice vouchers, the housing market is driven by profit. And so they're going to, the private landlords and managements, their motive is to protect their investments. And so even if it's at the expense of people who need the housing the most. So two tools that are used are third-party tenant screening, and then two, really long look-back periods, how far back a landlord can consider criminal history. Quick story. Yesterday, I got a phone call from a woman out in Western Kentucky. She was calling me because she was desperate, just needed somebody to answer the phone, and I do answer my phone. And she is currently homeless, but she is doubled up with a family member. She has been denied housing so many times for a felony drug conviction from 2010, so over 10 years ago. She's gone through rehab. She's worked the whole time. There's nothing to indicate that she is going to be disruptive and disturb the peaceful enjoyment of the premises for other tenants. But she had applied at an income-based place that should be more receptive. No, she was denied. She's just stuck. And so this is the kind of thing that we're dealing with. So there is documented connections between homelessness and jail, as probably does not surprise anyone on this call. These charts on the next 5 slides come from the Urban Institute. First one talks about how people incarcerated more than once are 13 times more likely to experience homelessness than the general public. You've got a significant jump between the general public and then people incarcerated just once, but as we know, for various reasons, people may be incarcerated multiple times. And so their chances of experiencing homelessness jump up considerably.
And help me understand, when you say incarcerated, is that sentence? Is that 2 nights in jail, or do you know?
This is from the prison policy
Okay.
initiative. And so I'm not 100% sure because I haven't gone back down to the source. So that's a good question, Steve.
But it is prison policy initiative, so you would think
Yeah,
it's
it's
not.
not, yeah, and so it's national and it's not Kentucky numbers.
Okay.
Yeah. Another thing that we run into all the time as a homeless service provider is that people who are currently homeless are routinely harassed, moved, swept, and just have more contact that is not positive with law enforcement and the justice system, as well as emergency services.
Yeah. And that's a Medicaid message there, right?
Mm-hmm.
Folks at Medicaid, more ER, more ambulance services?
Definitely. And so we'll talk about policy solutions. I don't like to be negative Nelly over here and be like, things are so bad, we can't ever make them better. But I want to talk briefly towards the end about, I want to expand on what you mentioned with the SMI task force and medical respite and the SUD SMI revolving door population. Yeah. I did not include it in the slides, but because I don't know why, but as soon as I sent the slide deck, I was like, oh, I'm missing some slides. So, but we'll talk about it.
Okay, super.
Cool. So Urban Institute has been charged with evaluating what is called an SIB, or a social innovation bond, I believe, in Denver, Colorado. And so what they basically did a pilot program, really doing housing first, right? Not housing only, housing first with all of the supports, and then evaluated the cost savings to the local governments and the state government. And so you can see they did a chart here, $80 for one jail stay, $430 for one arrest, $700 for 4 citations, and then $2,700 for 18 other police contacts. Don't get me wrong, I love the police, you know. I like having a safe community. I don't think I want to interact with them 18 times a year.
Right.
So, and then this is another evaluation, just showing from another program, supportive housing program participants had lower jail, shelter, and crisis healthcare costs than a comparison group, people who did not receive those services, because supportive housing is underfunded in this country. And then one last slide, talking about how interactions with people trapped in the homelessness jail cycle fell after COVID-19 hit. A lot of states, Kentucky included, kind of reevaluated their incarceration rates and their policing to try to minimize the public health risk that COVID-19 posed.
Yeah.
This is showing like, oh, hey, maybe we don't really need to go back to the way things were. So policies that work. At the Homeless and Housing Coalition of Kentucky, and as representative of KICH, the Interagency Council on Homelessness, we look a lot at what does work, what hasn't worked, and we are advocates for the Housing First program model. It's an approach to successfully connect individuals experiencing homelessness with permanent housing without placing unnecessary preconditions and barriers such as sobriety, treatment, or service participation requirements. And that sounds backwards to a lot of people, but 20 years of research, 25 probably now, has really shown that if you address someone's housing situation first, get them connected to permanent housing, and provide the wraparound support, such as the outpatient treatment, the counseling, all of those things that are required, you do that in conjunction with providing them a permanent place to live, you're going to have better outcomes. And it is something that, like I said, sounds counterintuitive to a lot of people, but it it has worked. We have in Kentucky, we have, prior to the pandemic, I don't really want to speculate what it looks like right now because the numbers change so much, but like we had really started to reduce the number of people experiencing homelessness at a point in time each year. And the idea here too is if you concentrate those resources on the people who are most likely to be using other services, other systems, ER usage, emergency department usage, hospitals, hospital readmissions, those sorts of things, then overall your numbers of homelessness are going to decline. There's some challenges with the implementation. Going back to the Housing Choice Voucher Program and public housing programs, nationally, only 1 in 4 families who qualify for public housing or a housing choice voucher actually gets it. And that's because it's not considered or funded as an entitlement program, such as Medicaid or SNAP. It is funded on the non-defense discretionary side of the federal budget. And so every year we have to fight over a shrinking slice of the pie for basic housing assistance. Housing First has been widely adopted by HUD-funded homeless service providers, but not every homeless shelter in Kentucky is HUD-funded. About half of our beds, our emergency shelter beds in Kentucky, are through HUD grantees. And so not every shelter or housing provider is going to adopt a Housing First program model. And you have some who very, very, very actively resist it. And then the other thing too is because the housing part of the budget comes out of the non-defense discretionary side of the budget, it's underfunded. It's not an entitlement. So we just have a limited number of permanent supportive housing slots in Kentucky and nationwide. Eligibility for Housing First programs require that the participant be homeless prior to incarceration and upon release within a relatively short window of time. So that's a definition issue. And then Recovery Kentucky centers, which some of you are probably very familiar with, may be appropriate for persons with substance use disorder exiting out of incarceration. They're in each of the CMHC's footprint, but they're generally geared towards serving one gender to the exclusion of another. And that's not a criticism, it's just an observation. If your numbers are showing, you have more men experiencing substance use disorder and needing a structured recovery center, then that's who your center is going to serve. But if you're a woman, you're going to have to go, if you want to go to a Recovery Kentucky center, you're going to have to go to another region where you may not have any sort of family or friend support, and you may not know a whole lot.
And as a CMHC guy, it's geographically in those areas. Some are operated by CMHCs and some are not.
And some are not, yeah. I was casting kind of a wide brush with that, with that bullet point. Okay, so if we have these challenges with homeless and housing assistance, what about the majority of people who are not receiving any sort of assistance? What are we doing about the rental market as a whole? Going back to tenant screening, we have, there's a pre-filed bill that's been filed by Senator Thomas in Lexington that really talks about, here are the things that rental companies or landlords can screen for. Here's the process. Here's the appeal process. And then also, evictions that were dismissed in court should not be considered. And also landlords should not have blanket criminal charge and conviction screening criteria for crimes that are not likely to adversely affect the property or health and safety of others. Somebody should not be screened out of being able to live in the community of their choice for, check kiting from 2002. And then one thing that we are very in support of is non-discrimination policies that include source of income, and that is included in this bill. When I say source of income, I'm referring to vouchers. Lots of times, there's nothing in Commonwealth of Kentucky except for Louisville that says a landlord can't put up an ad or put a sign in his yard saying no HUD. And so people who do win the housing lottery or get the golden ticket of a housing choice voucher or homeless assistance voucher, especially right now, the rental market is the tightest I've seen in 20 years of doing this work. It's really hard. It's very easy on the landlord side to say, hey, I don't want to do this paperwork. I don't want to make sure my property meets basic habitability or housing quality standards. It's too much regulation. But in the meantime, if we're shutting off, if people can't use their vouchers, then their vouchers are useless, and we don't want that.
Right.
Okay. The big picture, part of the big picture, you've got housing is unaffordable. The housing choice voucher, other voucher-based programs help address that. People can't afford the rent. We also know that we're short just homes in general. The building and preservation of homes in Kentucky has not kept up with our population. And so prior to the pandemic, we were short about 78,000 affordable homes across the Commonwealth. Louisville, it's about half, about half of those are in Louisville, it's about 31,000. And so we know that any solutions are going to have to address the housing supply. Representative Bridges out of Paducah has pre-filed the Kentucky Affordable Housing Credit. So it would mirror the federal low-income housing tax credit, and it would be basically a pilot for about 5 years. The idea here is to really significantly drive up the number of affordable multifamily homes.
And who gets that tax credit?
Developers.
Okay.
And creditor. It's a public-private partnership. The program model was designed in 1986 as part of the big Reagan tax overhaul.
Mm-hmm.
And so it's been operational at the federal level for, well, since 1986-ish. And so every state gets a certain amount of credits to award when projects go in and say, hey, we want to build a project in Litchfield. And we are a private developer and we're going to sell these credits. And it's kind of, it's real wonky, but it has resulted in some really, really good projects across the state. Okay, and then there's a little known project called the Homelessness Prevention Project, and it started in 2005 as a pilot, and then in 2016 it was given full statutory authority to operate permanently as not a pilot. And it started in Jefferson County, and its companion pilot project was in the Lake Cumberland Area Development District. And the whole idea is if you just place a staff member in some of these communities to work with people who are discharged from foster care, people exiting state-operated correctional facilities and mental health facilities such as Eastern State or Central State. If we can prevent people from becoming homelessness, that is the best outcome for everybody. And so in this year, the Department for Behavioral Health has devoted, they found, I don't know, they found some money somehow, good for them. Tom Beatty at DBH, the idea is amazing. And so they were able to expand the project to Bowling Green and to Lexington, New Vista in Lexington and Life Skills in Bowling Green. One other thing I wanted to say that Steve had brought up, and I wanted to expand on, was with regard to people who are kind of going through the revolving door of jail, hospital, street, and experiencing severe mental illness or substance use disorder. The Kentucky Interagency Council on Homelessness did a data request from the Cabinet for Health and Family Services, the Office of Health Data Analytics, last year. And they were able to pull some really interesting data from hospital discharge over in 2019. That was the first year that this type of data was really available. And so they were able to construct what they called a novel homelessness indicator to determine whether people were being discharged back into homelessness. We know that CMS really frowns upon this practice as part of their final rule that was issued in 2019. It's really bad for hospital readmissions, and it's really just bad on a humane level. And so what we found was we had 11,000 Kentuckians who were discharged from hospitals back into homelessness. And the readmission rates, which vary from different ad districts and different hospitals, I mean, they're hovering around 33%, which is not great for both health outcomes and for health systems bottom lines. And what we also found when I asked for the payer source was 68% of these folks are on Medicaid. And the number 1 and 2 diagnoses were psychosis and substance use disorder. So we know that we have a chance when people are discharged to not discharge them back to an underpass on 265 in Louisville. That we have a chance to connect them to permanent housing and allow them to recover. Part of the problem is if you are being discharged from the hospital with something severe, and especially if it's something physical and not mental illness related, a lot of shelters don't have the capacity. I mean, they're running on a shoestring budget and they don't have licensed clinical social workers on staff. They don't have the capacity to take people who need something less than a hospital, but above, just, people are okay, they can take care of themselves. So in Louisville, the Phoenix Healthcare for the Homeless is taking some of their special ARPA money that they got from Health and Human Services to really expand what is called respite to residence and make sure that they're caring for people at a really critical time. And the whole idea here is obviously I want to get people housed. That's where I'm coming from. But also from the healthcare side and the hospital side, they want to make sure that they're reducing readmissions and MCOs are their per member per month cost isn't through the roof and all that fun stuff. So we're very excited with the severe mental illness task force that met over the last year that Steve worked so hard to get going and was successful. The number 1 recommendation was to create a Medicaid waiver, to ask DMS and CHFS to do a Medicaid waiver for people with severe mental illness. And it explicitly includes exploring options for respite to residence. So that was a really long way of saying occasionally advocacy and government work. And so we should keep doing more of that. And with that, that's me and our contact info, and I'm happy to answer any questions that people may have.
Any questions?
It was an excellent presentation, Adrian. Appreciate it.
Yeah,
Thank you so much.
It was a lot of good information. And I think for us, as we look at reentry, that's our assignment, and I know, we can't recommend that Medicaid provide housing for everyone coming out of a facility, our friends at Medicaid will probably just fall over backwards. However, the effectiveness of the 1115 may very well depend upon housing. Right, Adrian?
Yeah, and it is, I mean, I think it is frustrating for Medicaid folks who are like, well, there's this whole other external environment that we can't control. But it is, they're very dependent upon one another. That's why I'm always really glad to hear that DMS from Leslie, that, you know, DMS continues to work with Kentucky Housing Corporation on doing some things, especially with these home ARP funds, which passed out the American Rescue Plan Act. I think we can do some really cool things with housing, people reentering and people with severe mental illness and SUD. Before we were kind of operating in the austerity realm, there was never enough money for anything we ever wanted to do. I'm not going to say that like we have all the money and we'll never be poor again. That's not it, but we do have more money than we did this time 2 years ago. And we should really, there are things that Medicaid can do on the tenancy support side and the case management and the peer support side that will help support the housing stability piece of it. That it is not room and board.
Right. That was good information. Appreciate it. Other questions?
Just wanted Steve, Charlotte, wanted Adrian to see that Lee Geis had put a comment in the chat. I actually sent the presentation out this morning and got the wrong lead to send to Lee Geis, so I've sent it out now, but there are some other folks commenting, Adrian, how much they appreciated your presentation.
Yeah. And we got some information from Carol Atkins. Thank you, Carol. So, all right. That was great. Last thing I have on the agenda, are there future agenda items members of the TAC would like to see included? I mean, clearly, you know, I reached out to Adrian because, you know, it took my prerogative was doing the agenda. Housing matters. So that's why we did that. But are there other pieces? Last time in September, we heard the great efforts that our partners at Corrections are currently doing and Medicaid's doing with those two facilities. We got housing, we got Medicaid update. Is there another topic that people think anyone wants to hear about at our next meeting?
I would, we do a lot of work with the ACLU reentry group, and Marty Johnson at the Department of Corrections is doing some really cool things. And I know we have Kristen Porter on and she did her presentation last time, but I think it would be great to hear from Marty on her work if DOC is amenable to that.
That seem okay?
Oh, hey, Marty, I didn't even know you were on. Perfect.
Oh, there you are.
Marty and I can discuss exactly what she would present because Marty is my employee. So whatever she would be presenting might be duplicate of what we just presented. So we'd have to kind of talk about it.
Okay. Check in chat. All right.
Yeah, I think there's a statewide group, a reentry group that meets. I think it's like 112 folks that are a member of that group that meets on a regular basis. I'm not sure if that's what you're talking about, and you're talking about Marty. But I was thinking Marty with his greater Louisville, I think it's Reentry Coalition, and then there's the ACLU kind of headed up reentry platform as well.
Yeah, Marty is with the Greater Louisville Reentry Council. All of our staff are sitting, they sit on the statewide reentry councils. There's several across the state. Marty is not with ACLU. So if you all wanted someone from ACLU to talk about what they're doing, that would be someone other than Marty that would do that.
All right, do you want to hear from them? Maybe Adrian could help us connect.
We can definitely ask the ACLU folks. Marcus Jackson convenes it, and he's great. So, and they're working on, we have two working groups. One is working on housing stuff, and then the other is working on larger decriminalization stuff. And so, yeah, we can definitely ask for a presentation from them for a discussion.
Yeah.
Oh, hey, yeah, Marty just put in chat, Marcus Jackson. Marty, you and I are in sync today.
All right, we'll reach out to him and get that scheduled if he's available. Hopefully he can make that happen. If not, we'll come up with an agenda for January. Any other questions?
Steve, this is Leslie. One more thing.
Yeah.
Give us a month or two, but then maybe we could have a Kentucky Housing and Health Collaborative, just give you an overview of what we've got going on with that group. But I'm probably going to need a couple of months because we're just in the beginning stages right now.
All right. We're scheduled to meet January 13th, so maybe we'll do that in March, Leslie. How would that be? That give you enough time?
Yes, March would be good, and I'll let them know at our next meeting.
All right, that's all I have, folks.
Let me say this, Steve, if you don't mind real quick.
Yeah.
I don't know if, and I don't even know who would be the best to reach out to, but if there was anyone like in the legislation area that knew what reentry, like if they had a summary of what reentry bills were being presented in session, this coming session or anything like that, so we could kind of get an overall view, this group could see what was being submitted, that might be an idea. I'm saying this out loud, but I don't even know who to ask that question.
Well, I'm going to hurt myself, I think. I do a legislative bill grid. I do one for the House, one for the Senate. I offered this to people last Friday. I can share that with the group. Honestly, I don't know if I've captured reentry bills historically, but I can add that. You know, and just to put in perspective, when I did this in the 2020 session, no, 2021 session, the House bill grid was 15 pages, the Senate bill grid was 10 pages. I mean, it gets really long pretty quick, a lot of bills. But I can do that and include reentry to that as well. And I'll go back, I bet maybe Adrian's already looked at some of the pre-filed bills on reentry. Other folks might have as well, but we can make that available to everybody and they can get, I don't mind sharing my full bill grid. You know, there's nothing on there, you know, I lobby, I'm a registered lobbyist. We don't list on the bill grid our position on stuff. It's just a standard form that has the sponsor, the bill number, summary that the LRC provides. It's just a shorter document than the full website, but we can do that. I'm trying to figure out how to put hot links in so you can click on the bill grid and go to the bill, but you know, I can drive a standard transmission. I can't do much more than that, you know, so I'm still kind of old school, but we'll make that available to everybody.
Are you using Word?
Yep.
If you, in Word, if you, on your document where you want the link to be for the bill, if you put your mouse and then you go up to insert, and you'll see hyperlink.
Okay.
And then you click on the hyperlink and it'll tell you to copy the link there. You copy it there and just click OK, and there's your hyperlink. Really, right there, easy, pretty easy.
Well, very good. Apparently, Charlie has a future in IT.
Oh no.
All right. But that's a good request, Chris. We'll make that available to folks. We'll send that out. All right, that's all I have. Anybody else?
I just
Appreciate
want
it.
to clarify, so I will get with Marcus Jackson
Yeah.
and the ACLU about the January 13th meeting.
Yeah.
And also, as I put in the chat, like I think ACLU would probably be the best resource on pre-filed stuff. So
Yeah,
I'll
I agree.
specifically ask for that. All right, just wanted to clarify. Thank you.
All right, appreciate it. All right, y'all have a good holiday. Take care. All right, bye-bye.